A new report is shedding light on drug use in the workforce as some of those findings are raising concerns. The latest study from Quest Diagnostics shows a sharp rise in fentanyl use during random employment drug screenings nationwide compared to pre-employment screenings. The North States News' Emma Underwood spoke with Quest Diagnostics' Senior Director of Science this morning. She joins us now live tonight with what the study means for employees as well as employers. Emma?
Now, Ariana, while these numbers are nationwide, they hit close to home when it comes to understanding how drug trends, especially marijuana, affect communities like Humboldt County.
Quest Diagnostics recently released its 2025 Drug Testing Index, which looks at trends in drug use across the American workforce. For the first time, the report took a deeper look at fentanyl, and what they found shows a major gap between workers who pass a pre-employment test and those who test positive later on.
Random positivity in the general U.S. workforce was 700% higher for fentanyl compared to pre-employment positivity.
Experts say that means many workers may be passing their pre-employment screenings, then later testing positive for the dangerous opioid fentanyl when random tests are given. The report also found marijuana is still the most commonly detected substance in workplace testing. Here in Humboldt County, marijuana has long been part of the culture and economy. However, experts warn there are important considerations when it comes to use on the job.
Marijuana use is getting more societally accepted, which is fine from that standpoint. I think we just need to understand the caveats of what that means from a scientific standpoint in terms of impairment, just like we do with alcohol.
The report shows fentanyl use in the workplace is often combined with other substances, showing 60% of drug tests that came back positive for fentanyl also showed other drugs in the system like marijuana or amphetamines. The report also noted that overall drug positivity slightly declined last year. However, rates are still higher than a decade ago.
Harwani says understanding these patterns are key for both workplace safety and employee health, especially as fentanyl continues to drive overdose deaths nationwide. Live in Eureka, Emma Underwood, the North States News.